Great.
Yes.
Sorry about that. So just reorienting ourselves each time, I'd like to start with this slide just to remind us all that when we plan our COVID-19 response and work together around this pandemic, we're really trying to take a more holistic understanding of health and well-being and not simply organizing everything around the prevention of transmission. And it's all a matter of weighing harms and benefits in a variety of domains. And the World Health Organization, I think, helps us see things that way in its definition of health as being the state of complete physical, mental, and social well-being, and not merely the absence of disease and infirmity. Just want to call your attention to a new website that we've been working to try and make our data as transparent and visible and usable to our public all along the way. And as another step in that direction, we've revamped our public-facing website there at coronavirus.marinhhs.org to add some functionality and additional variables and metrics that the public can view at the website with the new look and feel. So feel free to browse that. What I'm going to be sharing with you now are many of them are screenshots from that web page, and I'll just describe verbally what each shows. And there's obviously a lot more than this on the site. This shows the most simple graphic of our total cumulative cases since the beginning of the pandemic in Marin County. The blue line there represents total cases over time, and what's important is that the slope of that line is increasing. So we are seeing more and more cases on average each day, although there's some fluctuation. In the past week, we've had 2 or 3 days where we've hit record high numbers, and that's actually happening nationally across the state and the region. We are now up to 1,809 cases. We've had 82 people in the hospital ever since the start of the pandemic in Marin, and 26 are hospitalized currently. We have 28 deaths among Marin County residents, and we've done 38,622 tests. This is that same graphic of the increased numbers and cases over time broken down by age. And what's important here is that it shows this shift towards a younger age group. If you look at the top, current there on the right-hand side, the top yellow line represents people aged 19 to 34. So the majority of cases currently are in that younger age group. But if you follow that yellow line back into April, on the left-hand side, you see that earlier in the pandemic, we had many more older people who were being diagnosed. And that younger age group was actually a smaller fraction of our total cases. And that's been an important shift for us in Marin, and has been also seen across the nation. And in our case reflects the fact that we're seeing more cases among our workers. So essential workers who tend to be younger, out in the workforce. It also corresponds to a decrease in the proportion of people who become ill who need to be hospitalized because they tend to be healthier and have fewer of those comorbidities or age factors that we know correlate to more severe outcomes. This is an important, when I'm looking at our numbers, I always want to know, are we seeing more cases just because we're testing more? And that's certainly part of the story. On the bottom here, you showed just those bars represent the number of tests done each day. We had set a goal a month or so ago of 500 tests per day on average in Marin, and we've exceeded that goal. And we're seeing corresponding increases in ascertainment of cases. So we are seeing more cases, but importantly, we're also seeing the proportion of cases that are positive has also slightly increased. If you look at on the upper line there, from about mid-June, we started seeing an increase not only in the number of cases performed, but the proportion of people who we test who are infected. And that's a sign that we're actually seeing more virus transmission in our community, and it's not just based on testing. We've seen a slight decrease in the percent positivity over the last week or so, which is reassuring. One of the complicating factors for us in Marin in terms of looking at our numbers is that San Quentin prison is experiencing a large outbreak now that has more cases in that particular setting than we've had across the county combined. So what we've tried to do in some of our data is to divide out the contribution of San Quentin versus the rest of the county. I won't go through every detail on this, but it's on the website. And what you show here is it actually divides up our community and the San Quentin community, combines them and then sees them separately. What's most important about this slide is that top black line there that shows the total number of people who have been in the hospital in Marin County over time. We peaked at 35 hospitalizations last week, and now today we're down to 26. And if you look, up until the third week in June, the most we'd had was less than 10. So that was a relatively significant spike for us in the number of people in the hospital. And then this is just another way of representing what I've already described. The blue line shows the total number of people coming into the hospital, cases going up, and the yellow line shows the proportion of people who are hospitalized. And we see that, again, we're seeing fewer hospitalizations per case. This shows the demographics of the people being diagnosed with COVID-19 in our community. I think what's important here is on the right-hand side, those donuts that show the proportion of people in different race ethnicities within our county. That upper left donut is our total population. And then the upper right donut shows the proportion of our cases by race ethnicity, and you see the dramatic overrepresentation of people who identify as Hispanic or Latino. We obtain that information on everyone who's tested and can track the demographic characteristics of our results that way. This is the age distribution of people who are, again, on the far left, our population as a whole, and then our cases, the hospitalizations and deaths. And the most important take home, I think, of this is that when you look at that far right column of the number of people, of the characteristics of people who are passing from COVID-19 in our community, it's really almost all people above age 65. We've had one death. We've had 2 total deaths in people less than age 65. And this is known to us and is an important organizer of some of our strategies to protect people from mortality. One thing I haven't shared before, and I just wanted to bring it to your attention, that we are also tracking total mortality over time. So this is all causes. Obviously, we all die, and in Marin County, there's a certain number of deaths that are currently occurring just usually. And so I'm very, we want to make sure that we're not missing mortality that might be related to COVID-19 explicitly, COVID-19 deaths, and seeing how that affects our overall mortality rate, but also because of the effect of healthcare utilization, people coming into the hospital less. We've seen dramatic reductions in the number of people calling 911, partly because of the messaging and the fear around coming into hospital settings. Wanted to make sure that we weren't missing mortality that might be related to strokes or heart attacks or other things that might be sort of a consequence, but an indirect effect of COVID-19. And we have not seen any significant increases in overall mortality. So to summarize some of that, the primary driver of increased cases in Marin County is is what I've described of the really overrepresentation of our essential workers who are mainly Latinx. It's been the backbone of our workforce really since the beginning of the shelter in place. People who are not able to, for economic reasons primarily, shelter at home, much more reliant on daily income to make ends meet, and had been employed in sectors that were deemed essential. And then the dynamic there is that that person might become the index case, so the first case to bring it into a household where based on the living configuration and many people together in one household, more rapid amplification within that setting because it's more difficult for people who live in close quarters to isolate successfully when they are at home. So we're seeing household transmission there. Fortunately, a high proportion of these people are asymptomatic or mildly symptomatic and are diagnosed based on our contact investigation and not diagnosed because they're presenting to testing with active disease and symptoms, which corresponds to our decrease in the proportion of hospitalizations in this community. The strategies there are to partner very strongly with community-based organizations. We recognize that there's a very strong health equity and cultural intelligence lens that we need to bring to this because of the demographics of this group that's particularly affected, and that those partners are really our faith-based partners, our community-based organizations who work each and every day in those communities, the Marin community clinics, the federally qualified health centers that serves 30,000 people, mainly Spanish-speaking people in some of our low-income communities, a very key partner for us. Working to outreach to employers to make sure that the people who are working in those essential sectors and businesses are able to practice, what we know to be protective practices within the workplace. We're doing aggressive testing, contact tracing, and supporting for cases and their families, and offering income support, housing, food, and making sure that they're tied into the healthcare they need within the federally qualified healthcare system, the community healthcare system, as our kind of primary strategies to address that complex contributor to this epidemic locally. This is also, I would say, this is one of the dynamics that is shared across the state, the overrepresentation of Latinx in our current experience of the pandemic. The primary driver of COVID-19 mortality in Marin County, we have 28 deaths. At least 80% of them are among people who are living in skilled nursing facilities or residential care facilities for the elderly, where it's generally a staff member who will bring it into that setting, often asymptomatic, someone who unknowingly infected in the community, and then it's very, will spread within that setting. So there's a congregate setting, staff importation. All of those deaths have been above, people above age 70. And our strategy there is, and I've talked about this before, but to reiterate, we do outreach and education to all facilities. We have a team that's dedicated to this particular issue. We offer all of the, PPE, infection control, have issued a health officer order to prevent visitation, to try and prevent that importation, especially as we're seeing more transmission within the community. Also offer a health officer order that all facilities must test all of their staff monthly in weekly blocks. So week 1, week 2, week 3, week 4, they have to do at least a quarter of their staff so that they're continuously testing because of that risk of asymptomatic transmission into those settings. And then when we have through that testing strategy, if there's any one worker who tests positive, an aggressive on-site intervention, usually that day, to go through and test residents and other staff that might not have been on that particular week's testing cycle, to try and determine where other cases may be. It's not infrequent when we do find one case among staff and do that more widespread testing to find other cases had already been established within residents based on transmission that might have occurred before that person was diagnosed. And then the controlling transmission, especially in memory care units and other units where people tend to wander, is extraordinarily challenging, and it explains some of the reasons why, even in the best efforts, some of these settings have large numbers of cases. For example, there was a facility that was publicized in the media in Marin last week that had, I think, 60 cases among residents and about 10 in staff, with some deaths associated with that outbreak. I'm going to quick shift gears to San Quentin State Prison. This is the numbers from today. Over 2,000 now total confirmed cases in that outbreak. It's the largest prison outbreak, I think, now in the nation. There are, I think right now, 1,400 active. So those are cases that have been diagnosed in the past 2 weeks. There have been 10 deaths in that setting. There are eight San Quentin inmates in Marin County hospitals. 7 of them are in ICU. And so if we're looking at our hospitalization rates and taking San Quentin patients out of them to represent those from our cities and towns, we have a total number of 18 in the hospital. Thank you to you supervisors and to other advocates and elected leaders for really bringing attention to this outbreak that we had been really signaling as needing a more robust response right from the beginning. In fact, even before the outbreak occurred, really signaling that we are concerned that there had not been a plan within that setting for how to react should a case occur or should an outbreak begin, remembering that we don't have any specific jurisdiction or authority over that setting. It is a state prison and is viewed in the eyes of the California Department of Corrections and Rehabilitation as a piece of the state, not a piece of the county. And that was clarified to me as a public health officer when I, early in the course of this epidemic, recommended that they require facial covering for all of their guards, N95 masks, and that they have a policy where they prevent guards and other staff from moving between buildings to try and limit it to the one building where it had been established based on the importation of inmates from another facility into that setting where that other facility had been having an outbreak. So we watched, I think, from the margins as this unfolded. You authored a letter to the governor that was sent on the 24th of June, asking for the establishment of an incident command structure to manage this increasingly complex epidemic and to establish on-site medical capacity to take care of those men who were becoming ill. In response to that, another advocacy, on July 3rd, I was able to join that joint incident command that was established there with, and there's a lot of letters here, but it's California Department of Corrections and Rehabilitation, the Healthcare Services, Office of Emergency Services, California Department of Public Health, Cal OSHA, and Marin Public Health made up kind of the key sectors of that incident command with really two primary objectives. The first was to prevent new cases, and the most important strategy there was to establish tents in the yards. You know, these are in the areas where inmates are able to go out and play basketball and others. There's fields, and there's a baseball field and other settings where they became sites where we could have outdoor tents. And that became a resource architecturally to move inmates who were infected into that setting. And then obviously working with them to implement those infection control practices with more vigilance than we had recommended much earlier in the outbreak, including PPE and a policy to prevent guards from moving from one building to the next, so that it wouldn't be reseating second and third buildings. And then secondly, the primary objective was to care for sick inmates while protecting local healthcare resources. This was one of the real challenges for us as being the host county for a prison like that with an outbreak of such magnitude, was that we were really on the receiving end of so many of the transfers of inmates, Marin Health, Kaiser, as well as Novato Community Hospital. And we just want to acknowledge the dedication and just the healthcare belief, I think, and dedication to health equity of our hospitals, that they just completely opened their doors to these men who needed critical care. Before there had been a rational regional distribution network, our hospitals were caring for these men, and if it hadn't been for that, the outcomes would have been much worse. And all of our hospitals stepped up. Marin Health has a contract with San Quentin, and generally will receive inmates, but Kaiser does not have that contract, but actually ended up taking just as many patients at the end of the day as Marin Health did. And inmates are still being cared for in those settings. We also built medical capacity on site with a regional approach to hospital transfers, so that part of the incident command was that they were actually able to send inmates much more further afield if they were able to manage that transport time. Over 100 inmates have been transferred out of San Quentin for hospitalization across the region. This is what that medical capacity looks like on site. This was part of what I was working on when I was there. I spent the better part of last week at the facility, and we identified this site that's shown on the left, which was furniture making as a job training program, just a big warehouse that was actually ideal for setting up a field hospital. And that's what it looks like now, or that's on its way. This was as it was being prepared. But that's now active, and there's National Guard was called in to staff, 170 or so doctors, nurses, and other staff to really offer, when you have 2,000 cases among inmates, and these are inmates who tend to be higher risk for comorbidities, especially the condemned or the death row inmates, who are 700 or so, who tend to be older. Of the 10 deaths that have occurred so far, the vast majority of those are men who are on death row. And that's partly just because of the other comorbidities and age of that group. So to have the ability to care for them with a medical staff that knows how to manage COVID-19 on site was crucial, and that's now in place. And there's been far fewer transfers out. That's a summary of the San Quentin outbreak, and I think we can feel it's late. Just to summarize, it's a late response to a tragic and preventable event, but it's progress. And again, I think we thank you again, board, for stepping up to bring the governor's attention to this important issue. This is now policy for us in Marin. Our shelter in place has been, obviously we had the local shelter in place order that went in place March 15th. Since then, the state has taken a greater control over the policies that are in place in Marin regarding shelter in place through our status as being on the monitoring list. Last week, based on our incidents, the state added us to an ever-growing list of counties that are being monitored by the state, where the state then also has more control over what sectors are open or closed. The vast majority of the state is now on the monitoring list. About 80% of California residents are in a county that is on the monitoring list. And this map is not even complete. I think Santa Clara is also on the monitoring list and is not represented on that. But our neighboring counties, Napa, Sonoma, and others are also on the list. So there's been a shift. I think this has been one of the most important shifts of the last week. Is there really been a shift towards state control from local control over the shelter in place elements. So under the state order, closures of previously allowable businesses in Marin include indoor dining, indoor offices for non-essential businesses, indoor malls, and hair salons. And these were, indoor dining was based on our status last week as being on the monitoring list. We had to close indoor dining. That's something we had moved forward in the week before. And then yesterday, we had to also, under the state, close indoor offices for non-essential businesses, indoor malls, and hair salons and barbershops. And again, that's not pointing to the local public health officer order. That's pointing to the state order. The state also requires that we not do any new reopenings at the local level until we are permitted by the state. And so we are in a holding pattern where we are under the state order. Other broad-wide state closures across the statewide closures for all counties, whether or not they're on the monitoring list or not, include indoor dining, closing of bars, wineries, movie theaters, museums. So you get, the reality here is that the governor has recognized that just in the past even 2 weeks, there's been a remarkable increase in incidents across the state of California. And that some of that may be resulted, from the pace at which things opened over the past, after that more restrictive shelter in place, there was a relatively rapid sequence of openings that we, were concerned might be too aggressive with regards to just the dynamics of transmission. We had taken a more cautious approach in Marin, which has meant that we haven't had to take as large a step backwards based on our status on the monitoring list. We've had to take a small step back for those few things that we had actually opened that needed to be reclosed. But I think for most counties that are on the monitoring list, it was really a more dramatic reversal of things that had been opened. I'm just going to end with some enforcement. So this is, we now have a reporting, just wanted to sort of highlight this, a a way for citizens to report any violations they see of the shelter in place to sipviolation@marincounty.org. That's an email address where anyone can just briefly describe the nature of what they see as the infraction, and that will be monitored by our staff. And if there are themes, especially around a given business, that's something that we can send up to a newly established California State Strike Team, which is really has some of its authority based on some of the regulatory agencies that work over different types of businesses. For example, if it's a restaurant, they can use the Alcoholic Beverage and Control, the ABC board, to exert certain influence. We also have environmental health services here in Marin who do restaurant certifications and licensure. They can exert influence for infractions relating to barbering, cosmetology. There's a regulatory board there, et cetera. I won't go through all of them. This was started on July 3rd, the state strike force, and just in the first 2 days, they cited 54 businesses statewide, and they're moving across different communities, starting in those counties that are on the watch list. We're also in development of a local strike team under Angela Nicholson is working with the Marin Recoverers Group and our county council to develop an analogous strike team here in Marin County. And we will be looking to the SIP violations for focusing our work. These are some of the indicators. It's on the, I'll just briefly, this is on our website. People have asked, what are those things we're monitoring and where are we with regards to those things? So if anyone is interested, you can look on our website to see the indicators that we're looking most carefully at in terms of hospitalization rates, PPE supply, our testing positivity rate, and then where we are in each of those indicators at any given time. This is updated daily, and it helps guide our understanding of our as we potentially reach surge capacity in our hospital system. This is the messages that I think, that's the policy. I think ultimately we all recognize that this is in our hands, and it's about our own behaviors. And don't be this person that is infecting others by not covering their face. This is just a visual representation of what it looks like. This is, if we could make the particles visible, this is what we would see from someone who's just speaking without a facial covering. And you see how the person wearing a mask is partially protected, but not well protected. It's really the other way around. You wear your mask to protect me, and I wear my mask to protect you. And then lower, if they're wearing their mask, the number of particles that are emitted is dramatically reduced by about 95%. And here's another graphic representation of that also describes why we talk about the 6 foot distance, because that's where the majority of the particles settle. These are some of the graphics that have been put in Marin Recovers. It's for businesses that can be posted all around the county, just to remind ourselves of the importance of facial covering. And I will end with that, with my 10-year-old reminding us. He was at the Rosie the Riveter Museum, reminding us that when we do it together, we can do it. Thank you.